Biopsy of conjunctiva. The patient's face and eyelid are draped and prepped for surgery. Local anesthesia may be administered. A portion of the bulbar or palpebral conjunctival is excised with a curette. Sutures may be required to repair the wound. Biopsy of cornea. The lesion is superficial, the cornea is not perforated by the excision. Sometimes, only a portion of the lesion is removed for diagnostic purposes. Biopsy of extraocular muscle. A speculum is placed in the patient's eye and the physician makes incisions in the conjunctiva and sclera to expose the muscle. The extraocular muscle to be tested is isolated and the physician uses a scalpel to remove a small portion of the muscle. The surgical wound is closed with sutures. Biopsy of urethra. Using an open approach, the physician excises a specimen of tissue from the urethra for biopsy. At the site to be analyzed, a portion of the suspect tissue is excised by blunt or sharp dissection. The incision is closed in layers. Biopsy of cervix, single or multiple, or local excision of lesion, with or without fulguration. The physician inserts a speculum into the vagina to view the cervix. A small cut is made in the cervix and biopsy forceps are used to remove a piece or multiple pieces of tissue, or to completely remove a lesion. Bleeding, usually minimal, may be stopped by electric current, fulguration. Biopsy of intestine by capsule, tube, peroral, one or more specimens. The physician places a biopsy capsule attached to a tube through the mouth and directs it into the small intestine, usually with fluoroscopy. The capsule blade is fired by placing suction on the tube and a biopsy obtained. The tube and capsule are withdrawn. Biopsy, prostate, needle or punch, single or multiple, any approach. The biopsy needle is inserted into the prostate guided by an index finger or by ultrasound, and the needle biopsy sheath is advanced over the needle and twisted to shear off the enclosed sample. The needle is withdrawn, containing the sample. This may be repeated 2 or more times to assure adequate sampling, and the puncture site is bandaged.